The current state of treatment of type 1 diabetes should be preventing it from ever showing up. That having been said, because we have that capability now, but that having been said, there are three basic ways that we take care of type 1 diabetes. The first one is the one you know already. It's giving insulin. And giving insulin in various ways, either with an insulin pump or with subcutaneous insulin and so on and so forth. But right now, the focus is on three ways of treating diabetes, if you're talking about the future of treating it. And the first one is technological, by the use of insulin pumps and continuous glucose testing and computerized models and so on. The second one is transplantation, done in various ways. And the third one would be what we call immunomodulation, that is stopping the process, the autoimmune process itself. To my mind, presently, the most exciting option of treating type 1 diabetes is really technological, or as I like to put it, the techies have won. I mean, they really have, in a practical sense, beat out the immunomodulation people and the transplant people, in my opinion, because there's so much being done with insulin pump therapy and continuous glucose sensing and allowing the continuous glucose sensor to tell the insulin pump what to do, or what you're going to ask me about, the so-called artificial pancreas. Oh, tremendous. There are any number of groups working on they're right nearby us. There are a few groups that are working on it. To my mind, right now, it'll play a very large role because, you know, a few years ago, we were just looking at the sensor, and we knew that there was a sensor and a pump, and it was called open loop. And we knew that if you had an insulin pump and you had a sensor, that your A1C hemoglobin or your overall control was better, because you knew what your blood sugar was and could act on it. Well, then what they did is they introduced a little bit of computerization, if you will, with it. So Medtronic, for instance, developed a technique where when the sensor knew your blood sugar was dropping a little bit, it then shut the pump off. Kind of a primitive way of approaching it, but it did help. Now they're into different ways of doing that. Certainly here in the United States, and even more so in Europe, they are now using more sophisticated models where the sensor will tell the pump what to do in what they call a closed loop fashion, meaning the person with diabetes has to do nothing. They have to make sure the sensor is working and the pump is attached, and the sensor will tell the pump what to do. And that's full closed loop. What's better than that, at least right now, in terms of practical results, is what they call hybrid closed loop. In other words, I tell the pump that I'm going to eat, and then I give it a suggestion, and it does the rest. To my mind, there isn't a better way of controlling type 1 diabetes than using an insulin pump. It just is the most direct way of controlling it. It gives you the most option in terms of controlling blood sugar. So while we're waiting for that to develop, that's what I would do. It's certainly what I encourage all my patients to do, those that are type 1, especially the young people, is to start an insulin pump as soon as possible. Just a new person I just saw, a 20-year-old mechanic, and he was just diagnosed. We know that if we start someone on an insulin pump right away, right at the diagnosis, that person's course will be milder and easier to manage as time goes by. So again, that's what I would do, right now. That's the best way to do it. Other than that, it's conventional insulin therapy.